You managed to find the link?
Hi, Natasha.
Can you hear me?
Yes, Fuhrimann, I can hear you. Can you hear me?
Great, I can hear you fine. Thank you for joining. We'll just wait for Samuel to come on as well. But in the meantime,
Did he write back?
Sorry?
Did he write back that he was going to participate in this LS switch?
Okay.
Natasha.
Yes. Sorry.
I'm asking, did Sammy write back to confirm that he was going to participate in this quick trial?
Oh, that's a good point. Let me just confirm.
You have his mobile number?
Sorry?
Do you have his contact, the mobile number?
No, I don't have his contact. But I think he had said yesterday that he was happy with it. Let me just find out and confirm. So he did indicate that he was happy to join with for the pilot, but he didn't confirm when I gave him the time.
Now, I've sent him a message here. Let me see if he responds, because I'm telling him that we're doing this quick.
Okay,
but
thank you.
Maybe you could be taking me through as he connects. I don't see the video. The video is disabled, right?
Yes, I don't think you need to have the video on.
Really?
Or if you want to, I guess you could. Let me see if I can allow it.
Hi, everyone. I agree.
Hi, good afternoon.
Hi, Maxine.
Yeah, I agree. If you want to put your camera on, it's always nice to be able to see you when you are presenting.
Yeah, I think so.
Maybe we can just test it quick to make sure it's working.
Yeah, that's why I'm asking, because from my side, it's not showing that option for the video being enabled. Maybe I'll do it from your side.
Okay, Natasha, you make him a panelist, I think. Oh, there we go.
That might help. Yeah.
Yeah, let me do that.
Sorry, this is my first time doing this.
Great, there we go.
Yeah, I think the video now works in.
Great.
Okay, that's good.
But I think it's giving me a message that I can't start my video. The host has stopped it.
I didn't.
Yeah.
Wonder if there's a setting.
I think it's something to do with the settings.
Yeah, I'm just looking to see if there's a setting.
I could try. I still brings the same message. You have the IT person who does this.
I'm just trying to see in the settings if there's a way to make sure you can use your video. Maxine, are you able to use your video?
Yeah, she does.
Yes, okay.
Yeah. Okay, perhaps make
Mm.
them a host instead of just a panelist, and let's see if that works.
Okay.
Yeah, looks
Ah,
like
I can see you. Excellent.
looks like it's finally working. Yeah. So I think probably you'll have to do the same for Sammy before he connects.
Let's hope he comes on shortly.
I
Yes,
see him, right?
he's joined. Sorry, what were you saying, Aggrey?
Sammy has just responded that I think he's going to try to connect 5 minutes to 2 or something. So I think maybe he still has like some 3 minutes to join.
That should be fine. I think it gives us enough time then to just test his camera and his microphone.
Yeah, but I think tentatively we have what, like 8 minutes to go, right?
Yeah.
Yeah. Okay. So is there anything else I need to know from your side?
No, that's fine. It's more just to make sure everything was up and running, deal with any issues if there were any.
Is my audio clear?
Yes, your audio is clear. Thank you.
So it's only the annoying bit of you controlling the slides, eh?
Yes, I know. I'm so sorry about that. Yeah, is this, are you comfortable with it?
Of course, I think it's the only option. We have to work with what we have. I think that's fine for now.
Mm.
Yeah.
Okay.
Yeah.
So, Aggrey, did you take a look at the order of the slides? Everything was fine. You were happy with the final presentation that I had sent you?
Yeah, I looked at it. For me, it looks fine because I think you more or less just merge this the slides, right?
Yeah, that's
I
pretty
think
much it.
yeah, I think it flows very well, and let's see if it makes sense. I think my slides are quite many. Given the time I have, I'll have to make an effort to go through them as fast as I can. But I think the main point, the main focus from my presentation, I think, should be on the interventions themselves. What we
Yeah,
did,
and also,
yeah,
I think I gave the last bit a bit more time, so it should be okay.
yeah. And I think let's look forward to an interesting discussion, and we hope really the audience benefits from this. Let's hope it all goes well.
Yes, I believe they will. It looks very interesting already. Okay, so we'll just wait for Samuel to join us, and I think there's nothing more to do for now.
Okay, then I think I'll turn off my video for now.
Sure.
Okay, thanks, Natasha, for this.
Hello, welcome to those of you who have joined already. Please do introduce yourselves in the chat with your name, organization, and country, and we'll be starting shortly. Thank you. So hello, everyone. Good morning, good afternoon, good evening, wherever you may be. I'm Andrea Rother. I'm head of the Environmental Health Division. Just making sure that my team can hear me.
Yes, we can hear you.
Thank you. Okay. So the power's just come back on. I hope that I won't lose connection. So I'm Andrea Rother. I'm head of the Environmental Health Division at the University of Cape Town in South Africa. And I welcome you to this Pesticide Discussion Forum. Please do continue to introduce yourselves in the chat with your name, country, and organization. So I'd like to introduce you to our staff in the background. Some of you may remember that we had Tatum Lowe, who was for quite a long time the administrative support for the Pesticide Discussion Forum. And we now have Natasha Lalou, who's joined us. Natasha, perhaps you are wanting to turn on your video if you can. I can't quite see if you are a panelist, but if you are, please turn your video on and say hello to everyone. And Maxine is still with us as well and in the background. So thank you for that.
Hi, everyone.
So
I'm not sure if you can see. Sorry, Andrea.
No, we can't see
Video's
you.
working.
No, your video isn't on, but thanks, Natasha. So please do continue to introduce yourselves in the chat. It really helps our presenters to know where you're from and which country you're from. You're also welcome, if you can, change your name. So if you go to participants and you move the cursor over your name and then click on the three dots and say rename, you can put then the country in. If you're unable to do this, we will try and see if we can do it from our side. So we run these pesticide discussions with kind support from Sweden through the Swedish chemical agency CAMI. And really, it's a community of practice on pesticides that has been running for many years now. And we try to bring together representatives and stakeholders from different regions, from different sectors, to really foster a mutually supporting consortium on various issues related to pesticides. And really what we hope to do is to build the capacity of regulators and researchers and people from NGOs and other sectors who are in low and middle income countries or working in low and middle income countries to discuss emerging issues on pesticides and how we can address pesticides collectively and problem solve. And we do this by sharing information, data, looking at gaps, and as I mentioned, problem solving. And really, we are moving collectively toward trying to reduce and prevent pesticide poisonings, chronic effects, environmental contamination, with a view to a toxic-free future for the next generation. So it gives me great pleasure to introduce you to today's topic. We're actually going to be looking at interventions around occupational pesticide exposures in Africa, in the African context, agricultural sector. And we have two esteemed colleagues who are going to lead us through the work that they've been doing with the APsent Project. And I hope you will use this opportunity to ask questions as well as to provide information for this dynamic discussion. So I'm going to let Samuel and Aggrey introduce themselves. So Samuel, perhaps you want to first begin and introduce yourself, and thank you again for taking the time to be a presenter.
Yeah, thank you very much, Andrea, for the invitation, and I'm very happy to be part of this consortium and give you some insights today together with Aggrey on how we moved forward from observational research towards more intervention style research and hopefully impact, and would like to give you an overview on the network we built and also the view of the network and the research experts in the field around pesticide exposure in Africa. So I'm currently an assistant professor at the University of Basel and the Swiss Tropical and Public Health Institute. And my research interests are very holistic on agricultural health. And part of this is related to research on pesticides, but also very much on more global aspects of health and well-being of farmer families. And over the past decade, I worked a lot with Aggrey, Atuhaire, and colleagues in Uganda. And so I would like to give a word to him that he can also introduce himself.
Thank you very much, Samuel. Aggrey?
Thanks.
There you are. Nice to see you.
Yeah, nice to see you. Hi, colleagues. Good afternoon, good evening, good morning. Aggrey is my name. I currently work with the Rotterdam Convention Secretariat under the Plant Production and Protection Division under the FAO. But for the last couple of years, been working around sound management of pesticides, mainly with different interventions in Uganda. And Sami and I have been working together for more or less the last 8 years around this subject, and we're glad to be here on this platform to share our experiences, what we've done, what's going on, and the plans for the future around the same subject. It's an honor to be here and look forward to being part of this fruitful conversation. Thank you.
Thanks very much, and thanks, Aggrey, to you as well as Samuel for taking time, an hour and a half to discuss with us on this community of practice. We really look forward to hearing more about the work. So Samuel, I hand over to you.
Thank you. So let me share my slides. Can you give me a heads up if you see the full slideshow?
It's there. Yes, thank you.
Wonderful. So then let me start. So as you already said, Andrea, we are presenting some research which we did on our APsent project, so African Pesticide Intervention Project, where we indeed want to see what can we do actually to go from more observational research towards more intervention-like research to potentially understand the changes, the many changes within the agriculture systems, particularly in Africa, and with a focus on pesticide exposure and health issues. So this is a work Aggrey and I did together, also with many colleagues from the University of Cape Town, from Utrecht, from Monaco, from Swiss TPH. So it's really a huge consortium of research who worked on this, and we present also on their behalf. So the content of the first, 3 times about 10 minutes presentation. So first, I would give you an overview on what is basically going on in terms of agriculture and pesticide use in Africa, which then relates to a literature review we did on current research and potential gaps we see. In the second round, we will then talk more about the APsent network we established. So there's a network of researchers and stakeholders which we brought together, which we try to basically together move towards interventions. And then finally, Aggrey will present you some very concrete work we did in Uganda with an intervention study he developed together with UNESCO, and we tried to see what kind of effect this intervention may have and how we can ultimately improve it. Okay, so let me start with giving you some critical pictures of the African agriculture sector and why it is important to study it. So you just have to notice that there is a lot of people working in this sector. So it's many countries are dependent on the agriculture sector, mostly also on smallholder farming, and that also gives a huge dependency on many families on this sector. So the wealth of this, or the development of the sector, is very crucial also for economic development of each of the countries. However, there is often very many people quite poor in these rural areas. So there is many areas not so well developed, missing essential services, and hence these population groups are very vulnerable to change. And if you consider that there is rapid change at the moment in different directions of intensification of agriculture systems, there is quite a high risk for these communities in terms of many different health risks and outcomes. Yeah, and this fast transition is mainly driven by a need for much more food. So we need about double the amount by 2030. There is indeed an economic development which we see, which is partly also good, but it also is kind of critical that many people are left behind in this development. And there is also climate change, which is a powerful driver of these changes, because it generates basically different land use schemes, or it enforces different land use schemes on some area, and hence there had to be different crops. So there is different pests emerging, which is also then very critical for the development. There is also a lot of chances. So it's a young and rapidly increasing population. So there is indeed a lot of workforce around which can step in, but at the same time, this is also a challenge. So you have to educate this workforce in a very good manner so that they can also be part of the system and develop it further. So there is chances and challenges to that. At the same time, when particularly looking at pesticides, now in our case, the work conditions have to be looked at. So there is often very little personal protective equipment, very little knowledge, attitude, and practices towards a safe pesticide handling. And hence, there is quite a gap between what is somehow in the books and it's considered as a good agriculture practice, a safe agriculture practice, and what is actually the reality. When you look, for example, at some specific figures which indicate this intensification of agriculture systems, and here in terms of the total pesticide use, you can see it's a rapid increase. So just over the past 2 decades, it's skyrocketing. It's a doubling in terms of pesticide use, and largely this is due to the intensification of the land use. So there's different crops grown. There's much more crops grown in the same areas. Hence, there is a lot more agriculture or agrochemical inputs, pesticides, fertilizers, and other things which come into play. When it comes to specific pesticides, it's also quite interesting to have a look here, because initially insecticides were like the main thing which was used, but now herbicides and fungicides took over, and that is another indication of our land use change and a crop intensification. So there is a lot of, for example, no tillage farming systems which use a lot of herbicides, particularly glyphosate, which are very dependent on this kind of agrochemicals. At the same time, when looking into the literature, when it comes to what do we know about health risks, health impacts, we can see there is a lot of gap on the African continent. So here we did a literature review on all occupational studies which had a pesticide exposure focus and the health outcome. And you can see most of our knowledge we have, it comes from high-income countries, particularly from the US and Europe. Some of the BRIC states also contribute quite a lot, also South Africa. But then many countries in Africa, which are considered as developing countries or low-income countries, basically there is no knowledge about it, and most probably also no research done on it. So we did a particular systematic review to see what is actually going on the African continent, not just on the occupational side, so the occupational exposure and health outcomes, but also to see if there are any studies on the environmental exposure and risk, if there are studies on exposure of resident populations, on, for example, contaminated crops, food crops which are eaten. So quite a holistic review on different research items. And we could also plot it. So this is all the studies we identified. So it's almost 400 studies with almost 400, about 460 study sites. And we can see there is quite some hotspots around. So these hotspots are not just there by chance. They have also some story behind it. So particularly in the East Africa, with Ethiopia, Uganda, Kenya, Tanzania, around the big lakes, there is a lot of flower farming, but also coffee production with smallholder farmers. So there is a certain interest, particularly from Europe, just to have some studies at the same in the Western Cape. Of course, this is also very much driven by Andrea, Akhil, and Leslie from UCT. They established many different studies over the last decades. And then there is also some clusters in the west of Africa, which is mainly related to also smallholder farmer and also cotton production. But again, quite a lot of gaps on the continent. And when you look back to where basically the pesticides are used, it's not that this follows the pattern where most of the pesticides are used. So there is indeed quite some countries which have very little research done, but at the same time are quite heavy pesticide users. So the more red on the map, the more pesticides are used, according to the FAO. So around these almost 400 studies, we had the large chunk of it on environmental sampling, and then about a third on human subjects. So when you look closer, it's the environmental studies were used mostly actually to do human risk assessments. So for example, they measured air concentrations or contamination in food, and then they could out of that somehow compare it to a risk threshold and indicate if there is now a risk for human health. And similar things they did for the environmental risk assessment. And here it's quite a list of different matrices which were investigated. Most were actually on water and aquatic species, and then some other things around sediment, food, air, soil. So quite different matrices investigated. And on the human subjects, most of the studies were actually sorry, this jumps back and forth. I'm not sure why. Doing anything here, but yeah. So here it's basically a split in knowledge, attitude, and practice, which is very qualitative research studies, to some measured exposures and also some health outcomes. So it's almost equal distributed. And so here I would like to point out some gaps which we found. So indeed, most of the studies were actually done on females, on males, and on both genders. But then particularly the studies on both genders had very little percentages of female farmers. So it's often just the male farmers studied, while the females, they do go unstudied. At the same time, we also saw that there is very little research done on longitudinal aspects, so that studies were mostly cross-sectional. That means just look once at one time point and do not consider the change over time, which is very relevant, and as it's so rapidly changing. I think with a cross-sectional design, you can actually answer very little. And then ultimately, we were also interested in, is there any kind of intervention research done? So is there research done, for example, on training, on different other approaches to reduce pesticide exposure or health risks or environmental risks? And we've only found 4 studies which somehow looked into interventions. At the same time, the quality of these studies were also quite poor, so there was rarely randomization done, and so on. So Aggrey will tell you afterwards what would be probably a better design. When looking at different pesticides which were researched, that's another interesting thing to look at, is that most of the studies were actually on already banned pesticides in the agriculture sectors, on the organochlorides, and mostly on DDT, endosulfane, and others. Of course, some of them are still allowed to be used for vector control, but in the agriculture sector, it's actually not allowed anymore. But in the last 10 years, this was still the majority of studies which had this very focus. You find them because they're very persistent, but it's ultimately not a lot you can do about it because it's somehow residuals in the environment which are there for the next generation. And then we call them current use pesticides, the ones which are actually registered at the moment and also used. And here we could see that most of the studies were actually done on insecticides, but there was very little research on herbicides and fungicides, and even less studies which looked at mixtures, actually almost none, which had a focus on different aspects. However, the reality is that often there is 10, 20 different pesticides used by the same farmer, and it's always mixture situation. If you do not consider that, then you somehow have a blind eye on the reality because you cannot really single out individual pesticides. In the insecticide sector, there was also a strong focus on organophosphates and pyrethroids. These are relatively old chemical groups, still used in quite some frequency, but there is little research on the newer insecticides like neonicotinoid, which we see, which take over basically when it comes to the amount of use. So there is very little actually done at the moment on the current used pesticides and on the majority of the pesticides which are used. So very traditional research-oriented research questions, of course, they have their relevance, but when you really want to take some action on what is the current situation, then maybe a shift towards more herbicide or fungicide or mixture oriented research would be necessary. And again, the reference here to the FAO data, we indeed know that fungicides and herbicides took over in terms of the amount, so there are by far much more of these types of pesticides used on the continent. Good. So when you look at the different hotspots, and so that's also not so much different. So we thought maybe there is a difference between when you look at current use pesticides and organochlorine pesticides, but they often go just together. And what we also found out is that most of the studies who actually focus on DDT or endosulfane, they also then on the side measure some of the more current use pesticides, but it's rarely the main research objective. Another interesting feature of this review, and of course you can read the published paper, and we have also quite a substantial annex to it with a lot of other information and who did the study, who funded the studies, what particular pesticides were researched. But here it's interesting to know that there is most of the authors belong actually to institutions outside of the African continent. Within the African continent, then there is some winners, and it's not a surprise. The University of Cape Town, Andrea and their colleagues, they made up for most of the studies which they lead, basically, and then followed by Uganda, so Aggrey and his colleagues, and then some other South African university and also Nigeria. But yeah, this is also a critical point. So there's rarely capacity. So I think this kind of consortium, which Andrea established, is so relevant that we really have local capacity on the ground, which can drive research in the future. And particularly when it comes to longitudinal studies, cohort studies, that is really something which has to be driven and owned by local research institutes, so that there is no point in basically somebody from abroad conducting a birth cohort study, for example, over decades. Would also not be a good thing for then the results which are generated and the evidence which should go into a local decision making. From abroad, there is also quite a list of different institutions. So the Netherlands are leading, and then you can really follow then the funding schemes as well, which are then opening up. So the US, Norway, Switzerland are also taking part of that. Good. So in summary, there is most of the studies basically on knowledge, attitude, and practices, or questionnaire-based studies. So relatively poor quality study designs, exposure assessments, and most of the studies are on highly hazardous pesticides or persistent pesticides. It has its relevance, but it's not anymore what is actually used the most. So you may also consider basically a shift towards more probably lower toxic chemicals, such as different fungicides and herbicides, but as they're used in such a high frequency and such a high amount, the cumulative risks might be even higher. And there is a lack of integrated assessment, so there's rarely also combinations of health and environmental studies. Particularly also for the longitudinal assessment, there is some gaps. So you need studies which run for a longer time. You need studies with a focus on women, because they have completely different risks for some of the pesticides, and then also different measures you can take. And ultimately there is also very rarely a focus on the reality of the mixtures. So there is rarely any study which take into account different pesticides at the same time. So this is a very key thing to also do in the future. So now I would like to give back to Andrea and the team for the questions. So my
Thank you,
next
Samuel.
presentation is a bit shorter. Sorry, this was more extensive.
No, I thought this was really important, and it was important just how you went through it and the thoroughness of it. And you really have made the message very, very clear. And I think what's important, the visual of seeing, where the gaps are in the research is particularly timely, because UNEP is now setting up this science policy panel on chemicals and waste. And the whole idea with the science policy panel is they're going to do horizon scanning. They're going to look at research that's been done in order to prioritize which issues are going to be addressed. Mm-hmm. And if there isn't research, the panel isn't going to be funding or supporting new research. And so it really, really is important that we look at this question of how can we actually improve research in the countries and in the areas that you have so aptly illustrated where the gaps are. So thanks for that. So we are now going to go to the first question. So Samuel has highlighted, based on the research, some of the gaps that have been existing in the field of studying pesticides. And so the question is, what gaps do you feel still exist in the field of pesticide research in Africa? And you can answer this question in the chat. So if you can please just list what you think. If you have any questions for Samuel that might have been stimulated by the presentation that he gave, please also post those. It does help, again, if you post your question or comment and say which country you're from. That's always useful. We're also going to do a poll. That's why you can see things are being shifted a bit. And you'll see the link in the chat soon. Right, so Samuel, you're welcome to stay online, and you can turn your mic on when you want to respond to any comments or questions, and I will also assist you. So Samuel, there is a question from Ibukun, who's asking you what formed the selection of the selected pesticides?
Okay, yeah, thanks for this question. So yeah, that's a critical thing we also ask ourselves. We cannot ultimately answer it. So there is some things we think driving this selection, which is basically the history of research doing research on particularly these insecticides like different organochlorines like DDT and endosulfan, and also organophosphates. So there is established methods to study this and to measure it, and it's also relatively cheap. However, yeah, so that basically means that it goes always around the same stories, and particularly the cross-sectional surveys, they do not find very different messages. So it's good to repeat them so that there is risk, there is need for actions, but it somehow misses a bit then the focus on the actual situation. So what's happening now is rarely captured in these research studies. So then I would rather see or like to see a more qualitative research study or like a study which based on questionnaire interviews, but then has a bit of broader focus on the reality than measurements on, for example, organophosphates or organochlorines, which we know are hazardous, but then there the evidence base is already there, which one should act somehow, but then for many other things and other pesticides there is none. Yeah. And it's also expensive basically to look in on other pesticides, which is also a bit of a challenge.
Well, I think that's a key point, isn't it? That, you know, we're so funding dependent on the type of research that we do.
Of course, yeah.
So Leah has a question for you. So she asks, are there compatible studies from other regions of the world? And what are the similarities and differences? Is there an equal attention to CAP studies in high-income countries?
Yes and no. So it's quite, I would say, a thing to do CAP studies also in high income settings, so to really understand the situation. So they often use mixed methods, so they use a more qualitative approach to understand the situations, and then they dive in with some very specific quantitative methods to measure it. So we talk about different integrated study designs, translational research we do towards what is the evidence based basically on the quantitative methods, and how can we basically interpret that in a more semi-quantitative style to then also translate it to decision makers. So yeah, there is similarities, but what I think what is done more now in high income settings is this kind of integrated designs, and also the translational aspect are more in the focus, which I rarely saw in the African studies so far, that they stop with the observation of being a qualitative risk or a quantitative risk, but then they rarely had a link to other dimensions or a translational aspect. Except the one from Andrea, of course, because he does a lot of translational research. But you're quite unique there, Andrea.
Thanks for that.
Unfortunately, it should be more.
Yeah, that's true, unfortunately. That's very true. So there have been quite a lot of posts in terms of responding to the gaps. There's another question from Ethiopia, from Yared. What do you advise Ethiopia? How do you advise Ethiopia to stop pesticide use on flower farming? They think it needs a policy intervention. I'm not sure if this is going to be addressed more by latter questions. Latter discussions.
Yeah, so I think what could be done, because in Ethiopia, that's one of our research hotspots we identified. So there was quite some research done in the past decades, and particularly on flower farming. So I feel it could be useful to do their project on what evidence is actually needed and what evidence is there to influence decision making. So a similar project we have now in Switzerland, a similar project we did in Uganda and in Costa Rica. See what evidence is there and how can we translate that towards the institutional setups and the decision-making processes. So yeah, so that may be one part, and another part could be to see what are existing intervention studies or interventions done, so what are the trainings which are provided, and you may assess then the effectiveness of it to see what can be improved to actually change the situation, because the evidence is more or less there to see that there is some risks, but now it is also need to see how can this evidence be used to change the situation to the better. Okay, sorry, there's so many questions. Huh?
So it's mostly comments, and
Comments, yeah.
you know, well, it's mostly responses to question 1 in terms of what the gaps are, and some of them are quite similar in repeating previous ones. So, you know, on vulnerable populations, for example, women. I wonder, given in the interest of time, if you'd like to just comment on what you're seeing on the poll in front of you. So people have been clicking on the link, the Menti link that's in the chat, and responding. And maybe if you want to comment on that, Samuel, and then we'll move on to question 2.
Right. Yeah, I feel that that's a good thing, that indeed there is this gap on female farmers, and I also feel this should be taken up. That's also something we would like to take up. So we will build farmer family cohorts in Uganda and in South Africa over the next 5 years, and particularly giving the female farmers a voice, because they are so crucial to the system, but they are rarely researched. And I think with them, you may also have another impact than just focusing on male farmers. And another aspect is then the intervention studies, which are here on the second place. I think that's so critical because there is so much investment from the industry, from NGOs, and from government to train farmers, to change the system. Of course, there is a lot of economic interest, but there is this initiative. So one should address them and see how this initiative can indeed make a change, an actual change, and not just provide information, which are rarely changing attitude and never reach practice. So that is probably a wish we have. And we can also show you afterwards a bit and how we tackle that in Uganda. Good, back to you, Andrea.
Great, thank you for that. So we'll go ahead and move on to question 2, and taking us through that. I just wondered if the slides are going to be continued to be shared by our team, or okay.
Sure, so I can share. Is it fine for you?
I'm not sure who's sharing now, but it's on the screen.
It's on the screen, okay.
Yeah, so please go ahead.
Okay, so what I would like now to present to you is how we moved on from this literature review. So this was basically the start to have an overview on the situation, what is happening on the continent. And then we wanted to see, according to this literature review and our network we already have. So yeah, of course, Aggrey knows a lot of people, Andrea and others. Who can we convince to become kind of a member of a consortium which talks to each other and presents to each other the different research they do, and particularly also informs us what intervention should be done, how can they be done, and how can we do it together. So we also published a paper on that. There was a 2-day workshop we did in 2021, and this network is still active. So we hope we can do actually next workshop next year again, to recap a bit the situation. And I would like to present you now some of the findings and discussion points of this workshop group, and also highlight some of the things which we feel should be included. So the research network is basically mostly researchers. So we have rarely governmental authorities, NGOs, industries on board. I think there we would probably need a little bit of better balance also to get more stakeholders on board, which are actually on the ground and really working, for example, for the governments. And it's highly driven by South Africa and Uganda for the moment. Also, Nigeria played quite a big part. And then there is a lot of countries which you would wish that there is more people who could contribute to the network. But also some international groups, as you can see here on the picture. We asked several questions during the workshop to learn a little bit the opinions about the situation in terms of risks, in terms of different intervention scenarios. So on the left, you can see a question we had on the relevant occupational risks. So what should actually be looked at in the farming sector? Is it indeed pesticides or is it something else? But yeah, the consortium was more or less convinced that pesticide is indeed something which should be looked at and is very important, occupational risks. But then you should not forget other risks, for example, accidents, musculoskeletal diseases, dust, infectious diseases, and also mental health, which was rarely mentioned, but in our studies, this always pops up as something very crucial. And particularly with this transition now of farming systems, the mental health aspects become quite critical because there is a lot of stress to the farmers with these changes, and this often results in some particular mental health issues. When it comes to triggers for research, yeah, that's also not a surprise. So it's often international research networks and funding schemes which provide the funding for such research in the African countries. And there is actually not so much local programs which fund the bigger studies. So probably some smaller pilot studies, yes, but not more. When it comes to occupational research priorities of particular pesticides, you could see that there is basically no clear answer from the group, even though we feel that there is much more fungicides and herbicides used. Still, the experts still feel that insecticides are still a little bit more important or of equal importance, and that maybe refers to all the initiatives around the highly hazardous pesticides which are ongoing, which are very key. I think also to change the situation, as many of these particular insecticides are already banned in Europe or in the US and are indeed very toxic. When it comes to different barriers, and here it's also, yeah, a bit to see what are barriers basically to alternatives like organic farming or integrated pest management. We could see, for example, that there is a quite, an importance to the financial aspects. So all these farms are businesses, so they act as businesses. They have this as the main focus, and health is often an externality which is looked at maybe the 10th or 20th place. So it's not of such an importance to most of the farmers, and the finance aspect drives this. So maybe there is some insurance schemes you could implement for harvest loss or so, which maybe then can also help that situation. Another aspect is the lack of alternatives. So many of these conventional pesticides, particularly, they are very efficient. And when you switch to some biological control, so there is often not a really good alternative for acute control. That means also you need more education for the farmers. You need to train them to understand the biology of the pest, and then that they can apply these alternatives which are existing. But particularly for these low educated smallholder farming populations, there is rarely good alternatives which can somehow be equal to support these financial pressures they are facing. And promoters, there is many. So there's 4 or 5 which were listed more or less equal. So they're market demand, indeed financial initiatives or investments which can be done. Then I think a big point is also trust. We see that also in Switzerland, for example, when you talk to farmers, that they have to trust in the alternatives, and often that trust goes with basically neighbors who can already show them that this works, and then they can also take it on. So that's a good concept to also have it in the training, so that you have a peer-to-peer training, or you have local heroes which take it on and then start kind of a snowball practice. When it comes to different exposure pathways which should be tackled, and that was a bit of a surprise, it's that it's food. Though when looking, for example, at our data in Uganda, we see that occupational risks are there, but then at the end, it ends up as residuals in the food. So particularly for fungicides, for example, mangoseb, many or almost everybody was exposed to relatively high concentrations, and that was mostly via food, because there is often no very good cool chain, so there is fungicides needed even for post-harvest application to basically keep the crops fresh, but then at the same time you have these additional contaminations. Now with interventions, so what do we think is an effective intervention? And there's again different alternatives. So existing, there is often a very broad training material, which have basically a 2-day curriculum, for example, which talk about everything. That's maybe not the most effective. And I think the group was also clear that we need more training towards changing an attitude and not just improving the knowledge, so that you really also go out of the training with a potentially changed attitude, which you can then start to translate into practice, and not necessarily just basically that they gain knowledge and they can fill in a test and they are basically having all the answers right. But if nobody believes in it, nobody thinks this is a good thing, then you have no actual impact. So the interventions which are proposed, and they are also very much in line with the highly hazardous pesticide initiative, is basically using less hazardous substances, so switch to alternatives which are less toxic, but then potentially also less efficient. So you would have to convince the farmers that this is good and how this works and how this can be also as efficient as the previous solutions. And then there is, of course, some other aspects, again, knowledge, attitude, and practice, so that you address not just the knowledge and really go through this knowledge, attitude, and practice, potentially with a reduced training program. But then when you do training, then you really try to make sure that you at least change some of the aspects right, and not just give this kind of broad overview on the problematic or on the things they should change, which they then are completely lost with. And so the trade-offs to alternatives, and then there is also some issues with that, of course. So there is distress and insecurity, and we see that often when we compare organic and conventional farmers in our studies, that the organic farmers have much more stress. So they have more stress with losing basically the harvest, and they get no compensation, and also they have mostly more highly intense working hours, if they have no clear help, and together with mostly also a vision of doing something good. If this fails as a failure in terms of finances, and then you cannot support your family anymore, that ends up also in mental health issues and potentially even more severe issues. So you can see there's quite a long list to address as well. And so in terms of priority measures, I think it's also relatively clear. You've got these two things with the knowledge, attitude, and practice training, so that indeed is focus on the whole impacts towards practice and not just towards the knowledge increase, and also towards a less hazardous pesticide use, so that you switch indeed to alternatives to the highly hazardous pesticide. Good. With that, I would like to thank you and also acknowledge some of our collaborators. And Aggrey will talk about some more concrete examples which we actually try to then bring to the ground in Uganda afterwards. Back to you, Andrea.
Great, thanks, Samuel. So we have posted question 2 already in the chat, just to save time. So if people could continue, in fact, people are, I see, responding to it already. So the question is really asking if you think there are sufficient interventions that are already being implemented in the countries where you live or work, and if you could give some examples of those interventions and perhaps why you think they're successful. And if not, if you could indicate what interventions you think are needed. So we'll see you in the chat to discuss this, and we'll shortly have a poll. And Samuel, you can continue to have a look. I see there's some questions and comments.
And maybe to the point of not enough interventions, I do feel there is quite a lot of initiatives going on. There is quite some trainings happening, but it's probably not the context-specific training which is needed. So what I feel is really that these generic training modules which are existing, they should be more contextualized and maybe even reduced to some of the key aspects to change the situation. And in many different, also in each country, there is different solutions needed in each culture, and also in each farming system. So you cannot just go with a generic training to the farmers and train them. So you should really know basically your audience and develop or adjust the training which is existing towards this audience to really make an impact. So I would not ask for more, but I would ask for more specific and more quality in the training, which can fit to contexts. You see other questions, Andrea?
I'm not seeing any questions at the moment, other than what I've posted, which is sort of an open question for everyone.
You have a question? Or,
I was saying really the question is not only about, well, you use the word sufficient interventions, but how effective are the interventions? And is anyone doing evaluation studies? So people talk a lot about doing awareness raising and training and even legislative and policy changes, but how effective have they really been? So that was sort of my question comment.
Yeah, no, that's full in line with what we think. Is it's clear that there is a need for better knowledge on the impact and the effectiveness of these trainings and the interventions, because yeah, then you learn a bit how to change, adapt the trainings towards the real needs. And often with that, when you do an intervention assessment, there is a clear baseline understanding needed. So you need first to know a bit what is the baseline situation. So how well educated are your farmers? What are the main gaps? And then you should try to address them. And yeah, in Uganda, for example, we address it also with some behavior change techniques that we can then, with some of the main gaps, we can try to learn from the baseline studies to see what are the triggers, and then how can we basically change that to the hopefully better, so that you address basically the main behavior change criteria. For example, in Uganda, we saw that there is a lot of social norms which need to be established, for example, for PPE use. Before that, you cannot really change the situation. And it's a bit the same as in the Netherlands, for example, when you would wonder why nobody wears a helmet. It's about social norms, and nobody considers this is something good for driving bicycle. Well, in other countries, like in Switzerland, it's a bit different. So many people more wear a helmet. The social society thinks it's more relevant practice. So the risk is more or less the same when you look at it objectively.
Thanks. So we have a poll again. The Mentimeter link is in the chat, or you can always go to menti.com and put in the code, which is at the top. If you have any questions, please do post them. I know there have been some hands raised, but we prefer to have them in the chat, just to make sure that we move on in terms of time. So there are a lot of comments, but not any questions that I can see at the moment. So I don't know if you want to comment on anything that you're seeing, or if you want to comment on the poll.
Yeah, maybe on the poll. So there is indeed these many different aspects which are needed. Here it's also adequate policies. That's an also interesting thing which we saw now in our studies, is that policies are mostly there. It's often just not enforced, or it's copy-paste from somewhere, and then there is no kind of enforcement around it, or a kind of a reality around it. So it's the need that the policies are implemented in a way that they can also be enforced on the ground, considering local realities, so that it's also small steps, which are probably the bigger steps than what is actually proposed, so that you would not go for the very best vision of what should be changed, but you would like to address basically the most important gaps in the countries first, and then step by step build on that.
It's interesting because if you look at the responses in the chat in terms of, you know, what kind of interventions are being done or being needed, it seems to always be the same. And I'm wondering if we're kind of missing an opportunity for more creative interventions, especially now with having technology and being able to use technology more in rural areas. I sort of wonder if we're missing an opportunity here.
Yeah, right. And there is a lot of things you can do via smartphone. So in Uganda, and Aggrey will present afterwards, we used SMS-based messages to basically deliver some of the information, but they can be done, many things more. So you can use different gamification of your messages, or you can develop apps for younger farmers to really learn more about the situation and also guide them towards practice. I think that's also an approach we took now in Switzerland, so that the local authorities, they also translated now last year again some of the risk management in a completely different form. So they established a toolbox and a web application towards it, with a lot of different movies you can watch and a lot of different games for the farmers, so they can really take their knowledge to practice. So it's not first all the knowledge, it's really directly what do you have to do in practice, how does it look like, and simple tips and tricks basically, which at first may look like, oh, that's not good agriculture practice, but then at the end, when you really have the whole picture, it's the same story, it's just packaged in different, more digestible and more fun elements.
So there are two questions I think you'll have time to answer before we move on to the third. So the first one is from Bruce, who's asking what factors can lead to non-availability of alternatives, especially in low and middle income countries. And the second one is from Sheila. In the poll, there's no option for training in agroecology. And so she's advocating to see the quality of the training to be more on sustainable alternatives.
Yeah, so I think for the alternatives, when I use now the example from Uganda, so we did some studies there to see what is the gaps basically for bringing alternatives to scale. It's basically that we concluded that the established pesticide sales posts and sales shops, they do not sell the alternatives. And so this network is not used. So if you would use the same kind of distribution network for also the alternatives, then you could go to scale. But what happens is basically that the alternatives are somehow marketed on a different kind of road. So mostly via NGOs or small businesses, which cannot go to scale. And so there is rarely, I'm not sure if it's the interest or kind of the business situation of these small shops, which are somehow dependent on the conventional pesticides. But if you would somehow use them as distributors, you could really make a difference, because then you could bring the alternatives to the farmers. If you have to develop your own distribution network for all these products, the alternative products, then that is from the start impossible thing to do. And then of course there is rarely the understanding that many of the alternatives are actually not working so very well acutely, so that you have to use them as a measure before the pest arrives mostly. And so that is another thing to train the farmers, basically, that you have to basically prepare in a very different way than you are used to with conventional pesticide. What was the second point again, Andrea?
So you commented on the agroecology one?
The agroecology, yeah.
Yeah.
Yeah, the first one was on the alternative, now agroecology. So I feel this is a step too far. Sorry for that. I like agroecology, and I feel it's really a nice thing to do, but I feel it's a bit unrealistic to go to scale very fast. So you should probably, for the big mass of farmers, you should probably have more intermediate approaches to change. So you really have to look what is existing and how can that be changed. And of course, in parallel, you can still promote agroecology, but that will not be a game changer in a very fast way, I believe. Maybe I'm wrong. I hope I'm wrong. But it's a bit the reality we see over the past decades in the study areas we work, is that the smaller steps you take, that's what is making a difference to the better if you're successful. But then the bigger visions of agroecology, organic farming, and so on, that often leads into kind of nice visions and nice stories, but rarely to scale and rarely to impact. And it's very vulnerable to crisis. So with Corona, with wars, which rattling on the global market schemes for particular organic produce, which is then sold to, for example, Europe, that's not sustainable. And at the moment, at least for countries like Uganda and other low-income countries. So you may challenge me and give me a better unit, but my view is a bit different on that.
So we have run out of time, but I am going to actually allow Sheila to comment very briefly in a quarter of a minute on agroecology. So Sheila, I do think it's important for you to input on this. So please go ahead.
Thanks so much, Andrea. I'll try and be quick. It's a big story, obviously, and there's a lot of research into the lock-ins to the current situation. But I would just point Samuel and maybe others who are on this really interesting session to the example of our work in Benin, where some of the research he was referencing has been done. And we have a project there with organic farmers who in the last season earned 222% more than their conventional counterparts, because they weren't spending crazy amounts of money on synthetic inputs, the price of which has shot through the roof. I think all the elements are there. The trouble is there are big lock-ins and mindsets that think that agrochemicals are the way forward, and the agrochemical industry does everything it can to concretize those lock-ins. So I'd love to have a bigger debate about that. Also, vast amounts of investment in conventional agriculture. It's not about new money, it's about reorienting that money towards more sustainable options. So
Thanks,
Sheila.
Sheila.
I know time's short.
Yeah. No, I think we will note that perhaps we need to have another discussion on intervention specifically. It's a good topic for us to have as a discussion, and bringing in agroecology then. But thank you. I just thought it was good not to leave it hanging, but to have that discussion. Yeah. So we're going to move.
I very quickly comment?
And then we must move to question 3 because we stop hard and fast.
Very good.
The time.
Thanks, Sheila, for your comment.
But Samuel, you can come back when we have the discussion on intervention. So Aggrey, I'm going to hand over to you. We are going to move on to question 3. So I'm not sure if you have your own slides or would you like the staff to share their slides?
I think let me share from my side.
Okay, great.
If that's okay, Natasha.
That'd be good.
No problem. Go ahead.
Yeah, so let me, good afternoon, colleagues. Once again, good morning, wherever you are. Quickly move through, I think, building on what Sami has just shared, looking into the background of what is being done on the African continent. And it was based on that background that we came up with this idea of trying one of the sort of intervention studies, specifically in Uganda, more or less to look at some of the interventions that have been implemented and more or less looking at evaluating their effectiveness in different aspects. So I'll be diving into that. But I'd like to start a little bit with a bit of the context, specifically in the area where we did this intervention study mainly, which is Uganda. And quick aspects that we pick through, I think like most of the really low and middle income countries, there's still also a challenge of the unsound management of the life cycle itself. I think as it's been clearly put is that where the laws exist and are in place, but the enforcement is quite a gap around that. Same story with Uganda. Of course, it has different laws around this, specifically the principle, which is the Agricultural Chemicals Control Act of 2006. It spells quite a lot of things that can be done around managing these chemicals around their life cycle, but we see these gaps, and clearly what we see are gaps around the registration, mainly to see, especially the WHO class 1 pesticides being easily accessed by the communities across the country. We see gaps around the application, mainly to do with who is applying pesticides, more or less open to everyone. We see gaps around use of PPEs. We see issues to do with vulnerable groups, especially children being allowed to access pesticides. Still in the life cycle, we see gaps around the waste management in terms of protecting the water communities and all this. But then also we see to what extent is the food that is brought onto the local markets, to what extent is being inspected. So gaps also around food safety around this. The other context that we can point out, I think still also with the Ugandan situation, we look at more or less the unlimited or unrestricted access to all kinds of products. And the key message I want to bring around this is to point more or less in the direction of pesticide resistance. We see farmers easily accessing all types of pesticides and all different chemical groups and all different modes of actions. But the challenge around is that this is being more or less used more or less in an unguided pattern, and to a large extent, we see quite a lot of resistance developing around the different products. So that's also another contextual issue to really think through. The other aspect to put across still in the same context is the issue of the highly hazardous pesticide. We informed on this platform or this forum. This is a topic that is highly talked about, but also I got for this conversation, picked a bit of the extracts in the country situation report on HHPs for Uganda for 2020-2021. And I think this looked through that at the time. I think most of the pesticides that were being used, major of them around 41 HHPs that were identified. And also looking at this in the status of what were the products considered as HHPs that were legally registered on the Ugandan market, vis-a-vis the source countries where they're coming from, mostly Europe, looking at more than half of those were not approved in Europe, but they were legally registered in Uganda and being used. But also below we see the top 10 that were being imported in the country, but also we see the different countries of sources. And on this slide, I provide the link where you could go into the detail of this report that further breaks this information down. I think also the last contextual issue that I would like to mention is that over the years, I think working around this in Uganda also, we've run a couple of different projects before, trying to dig into this subject. And one of the areas we looked into, of course, is to do with the food and the water contamination. Basically with food, mancozeb is a big issue that is being high residues being detected, especially in the fresh fruits and vegetables that are picked from the markets, as well as from the local markets. But also a few years ago, we did this sort of cross-country study to look at the community water sources, where the community picks water for domestic consumption. And this was looked at picking samples before and after cropping season. And we found up to 25 different pesticides. And the big story in this was glyphosate in much, much higher concentration across the country in different community water sources that people fetch on a daily basis for home consumption. But also we realized that products that were in much higher concentrations of the 25, most of them were categorized as HHPs quite there. But also in the other two works that we've also been doing with SAMI, we did some work, a project called Pestrop. We're doing this comparison between Uganda and Costa Rica. But part of this, we did some biomonitoring, but also environmental monitoring. And in part of the human samples, specifically urine, that we found that almost all the samples we got had this, the ETU, which is a metabolite of mancozeb in the urine samples, but also we found quite high levels of copyrefos in the urine samples from the farmers getting exposed to these products. But also we tried to link these exposures to different neurobehavior aspects, and some of the key information that we picked from there, we can see that specifically mainly seeing glyphosate being significantly associated with impaired vision, but also other aspects. In the community water sources around that, I think we found about 25 different pesticide products, predominantly 2,4-D and carbendazim. And this paper also, I provide links to this where there's quite some detailed information in this for people who are interested in this. So this a bit of the background, at least on the exposure, sort of objective exposure assessment that has been done. So it was based on this that and looking at the interventions that were in place to try to see, can we assess really how effective some of these interventions that are being carried out are. Specifically, we did this in Uganda about 2 years, 2021, and a picture of what we see in the community. And the thinking process around this, how we conceptualize this back in early 2020 when we were starting this design, was looking at probably 4 different aspects that's to do with the knowledge, attitudes, and practices, considering specific behavior too with the use of PPEs, linking this to the exposure, which can be both direct by the applicators, also potential maybe indirect exposure by the re-entry people, but also how we link this also to, let's say, the self-reported signs and symptoms, but also we are cognizant of potential confounders, let's say for the knowledge, potential confounders for the attitude and all. So this was the thinking process back at the start of 2020 when we are thinking this. But later I'll show a more revised conceptual framework in terms of how we better want to understand this when we introducing the interventions. So this study that we did was more or less a randomized controlled trial, and we randomized different clusters, about 12 different clusters. So we collected data at 2 points in time. That's at the baseline. That's in October 2020. Then after that, we dived into 2 different interventions. That's a face-to-face training, but also sort of an SMS campaign for sending farmers SMS reminders on their phones. Then 12 months later, at the baseline, we did a follow-up or the end line, and to see what differences could we see among the 3 different intervention groups, and what aspects could we attribute this to the interventions that we did. For the interest of this conversation today, I will not go so much into the data collection and what we did around there. I'll dive more into the interventions, what interventions were we more or less implementing and evaluating to what extent they could influence the different aspects. Majorly, we did 2 interventions. The first one was the training. And as a project, we were not trying to design a new training, but rather we were looking at a curriculum that was in existence that had earlier been developed by UNACO and adopted by the Ministry of Agriculture, more or less part of a sort of a standard curriculum. And we wanted to assess, or wanted to implement or impart this training to the farmers, and later assess how effective it is in improving their knowledge, attitudes, and practices. So this curriculum has 5 different modules. The first module more or less gravitates about introducing the subject of pesticide, and more or less looks into aspects of the naming of pesticides, how they are grouped, looking into detailed interpretation of the label to the layman. The second module more or less focuses on the health aspects, looking at the different effects, both the short-term and the long-term, looking at the different exposure pathways, looking at the different practices that result into exposure, so the different entry points, but also diving deep into the safety precautions along the life cycle, right from the point of acquisition of the products up to the end, which is the disposal, but also to do with the food that is consumed later on. But also it has a specific also topical training on management of acute pesticide poisoning, and we did quite some work also here. So the third module more or less specifically focuses on the environment, looking into how do these chemicals break down once they are applied on the crops. How do they move from one point to another? What are the different vulnerabilities within the environment, aspects to do with bees, fish, and all this, but also the precautions or measures that can be taken to protect the environment. Then the fourth module goes more into the precision training techniques, looking at the locally available spraying equipment, guiding farmers on the equipment they are using, how do they maintain them, how do they choose this. But the biggest volume of this training or the big module is about integrated pest management. And this curriculum dives deep into understanding of this concept, but also looking at the different methods of integrated pest management, whether it's culture, whether it's host plant resistance, but diving into the detailed examples and explaining them in the simplest way to a local farmer, but also the different sort of IPM packages. So more or less, this is what the curriculum is about, and this is the curriculum that indeed we delivered to the farmers. And the main reason of delivering this was indeed to impart their knowledge, but also try to influence these trainees' attitudes as well as improve the practice around the subject. This training was delivered to about 360 farmers, and they were divided into smaller groups of 45. And each group of 45 was receiving this detailed training of the 5 modules in 2 days. And this was being delivered in the local languages, in the local dialects, and using different methods with the short videos, doing a number of practical demonstrations on the PPEs, on calibration of spraying equipment, using a couple of visual aids within class, things to do with labels, different types of PPEs, quite a lot of group exercises, but also some sort of infographic information material to take home. So more or less, this is what the first intervention was about, and it was imparted to this group of farmers. So the second intervention was of the 360 farmers who received this training, who formed the intervention of group 1, half of them received a second intervention, which was about sending them SMS messages on their phones after the training. And this was informed by the group, another group we work with from the University of Bern, who are the experts in these psychological aspects. And we based the SMSs that we are sending on this sort of model, which we call the runners model, that takes into aspect the risks, the attitudes, the norms, ability, the self-regulation. But mainly these SMSs, we sent 20 different SMSs, but these were spread over quite some time in about 2 to 3 different phases. Some messages before the start of the spraying season, then others during the spraying season itself, and a little bit after the spraying season. But these messages mainly gravitated around PPEs. The design of the message was around trying to influence the use of PPEs. So that's the intervention, the second intervention that we did. And we have quite a lot of data to work with. And honestly, we've not dived much into it. Preliminarily, I could show 1 or 2 slides of what quickly we've picked out. One aspect, let's say, that is linked to the first intervention, which is the training, has to do with the knowledge. There were quite a lot of knowledge questions, but specifically we pick out the more practical knowledge aspects that has to do with the interpretation of pesticide label. And here it's more to do with the pictograms that a farmer, even if a farmer didn't go to school, something visual that they can look at and the label and understand. This was part of the module 1 of the training. And here we assess what change do we see between the baseline and the end line in terms of the knowledge, change in knowledge. We see quite, first of all, we acknowledge that even the baseline itself, in a couple of aspects, farmers were able to interpret a couple of pictograms. Let's say about gloves, gumboots, the eyewear protection, protecting of the nose and the mouth. But what we see across in the end line, we see this improvement in the knowledge per se. And also we see these sort of changes or differences between the 3 intervention groups. We realized that the group which received the 2-day training in most cases performed better than the group that didn't receive any training, which was a control group. But also we see in most cases the group that received the training but also continued to receive the SMS reminder, also performing better in terms of knowledge in a couple of aspects. But for now, this is still on the surface, what we see, at least from some of the few aspects. The other aspect that we quickly looked at had to do with the practice, and we pick PPE use here, this more or less link to the second intervention, which is about the SMS reminders. And this is more or less self-reported PPE use. Well, how was the situation at the baseline, and what do the farmers report at the end line? At the baseline, of course, we saw a couple of people already reporting to be using gumboots, to be using the long pants or their own long-sleeved shirts. But generally, we see the practice was quite on the low side at the baseline. And what proportionate change do we see in the end-line results? We also quite see some improvement in certain aspects, let's say farmers using the waterproof pants, but also we see these different changes among the 3 different intervention groups, mostly seeing the farmers who receive the training, but also receive the SMS reminders, relatively performing better in this practice. So we see improvements around the use of the long pants, waterproof pants. We see also reported improvements in farmers using the overcoats or long coats. We see reported improvements on the overall. When it comes to the protecting the nose and mask, this was a special case. Of course, we see a couple of farmers using the mask that don't have a carbon filter. But of course, also given that we undertook this assessment during the COVID times, of course, everyone was wearing a mask. So not so sure whether it was mainly specifically to protect against potential exposure or the practice of using it for COVID itself. But after all, anyway, the one with the carbon filter is more or less as good as useless when it comes to protecting against pesticide exposure. But we see a couple of improvements also on the low side. And notably, we see this improvement in practice about the gloves, specifically the recommended gloves, which are the chemical resistant ones. And we'll be further understanding this, but most of the SMS intervention gravitated around a lot around gloves. And we're glad to see this, but still on the surface, as I've mentioned, and I think as we dig deeper, we get a much more clearer picture on this subject. So the next steps, what we are looking at is
Aggrey, just to let you know that we've actually got 8 minutes left, and we do want to still discuss the question. So just to let you know. Thank you.
Thank you. So the next steps indeed is to really dive deep into this proper understanding. And what I mentioned is that led by Sami and some PhD students, a group diving into this, trying more or less to conceptualize how we understand this, linking the different interventions, let's say the primary outcomes, to see whether the training and let's say the training and the SMS and how well the outcomes around the knowledge, attitudes and practices, as well as the overall PPE use, but also other potential secondary outcomes around exposure, let's say exposure intensity scores, the self-reported health outcomes, and of course the specific area around the use of gloves. So these are the next steps, and we look forward to, of course, sharing the publications from this work and participating further in this community to further share what will have come from this work to complete the whole story that we started today. Thank you so much. Over to you.
Thank you. Sorry, I didn't mean to interrupt you. I just want to make sure that we have enough time for you to engage with our members as well. So my apologies. It's very, and we just need to make sure that people also have access to the publications that come out of this, and if people have more questions. So there are questions. People have started responding to question 3. What are the barriers to implementing interventions? And so I'm just trying to see if I can find a couple. The people are focusing on lack of funds. Benedict was asking if any monitoring or evaluation has been done on the effectiveness of the training.
I think to respond to Benedict, that's exactly what we are doing, because what we did is that before we did anything with the farmers, we started with a baseline survey, which was more or less understanding where do the farmers currently stand in terms of their knowledge, in terms of their use of PPEs, in terms of the self-reported potential exposure, but also self-reported health effects. Then after that, that's when we went into the intervention, specifically the first intervention, which was the training. As I've mentioned, this was a curriculum that was previously used amongst farmers, but this project wanted to assess how well does this training work? Can it really change farmers' knowledge, attitudes, and practice? And that's why we implemented that intervention the way it is, the way the curriculum is designed, and then went back later and did an end-line survey. So I think it's the comparison between the baseline and the end line that will tell us, did the training really indeed improve farmers' knowledge, attitudes, and practices? Or if indeed it improved the knowledge, do we see that similar change, let's say in positive attitude? Can we see similar improvement in practices? So it's the results that will tell us that, but what he's asking is exactly what the study was doing.
Thanks. We have posted the poll, and the link for Mentimeter is in the chat again, so you can just click on that. So I asked you a question. I wanted to know if the SMSs that were sent around the protective equipment was only about using it and wearing it, or was there information also in terms of where people could buy the PPE or have access to it? Because I think often the problem is not having access to the right PPE that's not too expensive.
Yeah, thanks, Andrea, for this. I would say the SMS is focused more on the psychological aspects of using PPEs, and this had to do with how people perceive the risk from the exposure to the pesticides. But also questions about the potential costs and benefit of using PPEs. Also an aspect to do with, let's say, if my fellow farmers look at me putting on these PPEs, what will they think about me? That perception of other farmers, if it can influence a person using the PPEs. But more or less, I would say it was designed more or less about encouraging the farmers to use the PPEs, and whichever PPEs they could use, because one, they had come from the training and indeed they knew the different types of recommended PPEs. So the first round of SMSs was asking them whether indeed they were considering to buy or use any PPEs. Then later messages were more or less following them up to see if indeed they went ahead and implemented that action plan. And along this, we had also sort of 3 different types of phone calls following up with the farmers, first of all, sort of as a fidelity aspect to see if indeed they are receiving the SMSs, but also following up the farmers as per their action plan, let's say, to say, earlier on, let's say a month or 2, you told us you are planning to buy gloves and maybe a mask. Following up, indeed, have you gone ahead to implement this kind of plan? So sort of fidelity of this intervention, we had also at 3 different points in time during the SMS intervention, following up the farmers themselves to see how they were progressing with this in a way.
Maybe to add here, Aggrey's comment, we indeed use this RANAS approach, which is basically looking into risk factors, attitude factors, norm factors, ability factors, and self-regulation factors of PPE use. So it was first basically the baseline data we had, and we analyzed that and identified triggers. So which are triggers in the local context of Uganda we can use for the SMSs to change the situation. So for example, we identified that they would need to know where to buy PPE and how expensive they are. So these messages were very much tailored based on the context and on the baseline information. So this behavior change assessment methodology helped a lot. But of course, first you would need to know what to focus on. So the knowledge, attitude, and practice assessment was much broader. And with that, we identified PPE, and particularly glove use, as some of the factors which we would like to see if we can particularly change that.
Thanks, Sami. I think also maybe to comment on the poll, and I think I see the responses. Indeed, the first intervention, which was the training, indeed it was focused more on the knowledge, pesticide-related knowledge, attitudes, and practices. Yeah, that's true. And the second one, which was the SMS interventions, indeed it had to do with changing the behavior around PPE use. And it's also true that the design, indeed, it was randomized where farmers were put into different intervention groups. But I think also there's a comment, Andrea, that made whether indeed the industry should use or should subsidize the PPEs. And I think Sheila is commenting about the high lack of controls, and it's true that I think PPEs are considered at the real lowest level. But of course, I think in the tropical sort of climate context, there's challenge around using PPEs. But I think one, for them being available, I think things to do with the climate in the tropics, of course, adaptations could be made, I think, one, to the time of spraying, whether someone sprays early morning or late in the evenings. But I think Andrea is right also, the availability of really standard, but also affordable PPEs in these local shops across the communities, they're also not there. And we saw this from the training, where I realized some people are seeing certain PPEs for the first time, and especially to do with the mask and the respirators. People have limited knowledge around this. But I think something around also subsidizing, I think them especially something like gloves, because they are really cheap. I think having these also really subsidized and available in local community shops. I think as these trainings and awareness creation interventions go on, if people can be able to access what you're telling them about all the information you're giving them, I think it could also go a long way that farmers are able to easily see and access what is being really raised awareness about. Yeah.
Maybe also to add here very quickly, I feel subsidization of PPE is one thing, but then at the same time, they should also do a more tailored training and basically information marketing of these PPE to the farmers. So they need to understand the trigger points, why they are not using it. And most often it's not the price. So it's, if they would really understand why they would use PPE, then that the price is then probably not the main argument. So they need to be aware that it's existing, it's effective against a specific exposure pathway, and they need to believe in it. Yeah, so it's not as simple as that to just provide it. I feel it's much more, and it's a bigger responsibility than just making it basically available.
Yeah.
Thanks, Samuel, and I agree for that. I think, maybe we need to have another discussion on PPE as well, although as Sheila points out, it's at the bottom of the hierarchy of control. There are two questions and comments from Sheila I'm going to ask that you please respond to in the chat, if you could type your responses, as we have come to an end. So she wanted to know if crop life training, if any of the experiences were shared with you. And the other question I've lost. You'll have to look for it. There's another, she has two questions for you.
And Andrea, if I could make one last comment.
Yes, I will give you. So I just wanted to say to everyone, my apologies, we are 1 minute over and we are very strict. We usually do end on time. So if I could please indulge everyone for 1 more minute for the presenters to sum up, and then I will conclude. And please do keep posting your comments on the poll. Aggrey, over to you.
Yeah, thanks, Andrea. I think what I would like to mention is that I think talking now from the angle where I'm working now with the FAO, I think Sami earlier pointed out to do with the training. I think through the FAO work we do, we acknowledge, I think, use of farmer field schools or practical learning in the field. Let's say a season-long learning, I think, would be the way to go. So much as we implemented this 2-day training, we feel, I know from my side, that it's not sufficient. So I think in terms of intervention, I think a training that is delivered in form of a farmer field school where the learning is on the farm, I think is a more practical approach that could go a long way in changing the practice. Thank you so much.
Yes, and thank you for making a pitch of that. I think there are not enough farmer field schools in countries, and perhaps that's something that needs to be implemented with research, as well as looking at the effectiveness of farmer field schools, as well as advertising them more. So just before I conclude, I do want to say that the problem with PPE we have in South Africa is that people are wearing dust masks rather than the respirators, and that is very much a cost factor. But I do think that we have to have this discussion further. So I'd like to thank our presenters very much, Aggrey and Samuel, for your time and for your very important work and research that you're doing. As you can see, there's a lot of interest, and also you raise very adequate and important questions that we as researchers need to be addressing, but also that policymakers should be hearing more about this research. So I hope you'll come back when you have more information, and you'll join us on the future discussions, especially when we talk around alternatives and PPE. And just to let everyone know that the next discussion will be on the 8th of June, where we'll be looking at drones and the application of agricultural pesticides with drones, and we'll have an example from South Africa. So please do put that in your diary. And please make sure that you've joined the Pesticide Discussion Forum or the WhatsApp group. The links have been put in the chat. The links for the various presentations today have also been put in the chat. If you join the Pesticide Discussion Forum, then you will receive the digest. So there'll be a summary of today's discussion, and any questions that were not answered or that the presenters would like to give a bit more response to will also be in the digest. And you can always reach out to us. So I'd like to thank the staff in the background. So Natasha on the success of her first Pesticide Discussion Forum, and Maxine, there's also an evaluation on the screen for you to complete. And I'd like to thank all the participants. You were very active today, so thank you very much. So thanks again to the presenters and to all of you, and enjoy the rest of your day. Bye for now.